Please, both ends of it.
Sure. Jeff Belkora, Jeffbelkora.
And what's your title?
I'm an assistant professor at the University of California, San Francisco.
And what specifically do you do? What is the program that we're interested in? Could you describe that a little bit?
Sure. Yeah, I work on ways of getting patients involved and informed about cancer treatment decisions that they are facing. So, for example, there are 10 million people living with cancer and 1.5 million people who are diagnosed with cancer every year. And many of them really want to be as engaged and informed as possible. And so I developed strategies, and we've put those strategies into place in a program here at UCSF. And more generally, we work with other organizations to help them put those strategies into place to get patients informed and involved.
And you say informed on that, I mean, patients are going to their doctors, the doctors are giving them information. Why would they need somebody else to kind of help them get? Are they not getting enough from the doctors? Well, what's the reason for this?
Well, when you go see a doctor, often if you've had a cancer diagnosis, that's a really overwhelming piece of information all by itself. And so you have a fight or flight instinct, and your defenses and concerns go up. And that actually makes it harder for you to process information right at the time when you really most need to be on your game and being right there and processing the information. So some of the strategies we encourage people to use are write down a list of questions when you're going to see your doctor. We want you to get information from your doctor. Your doctor is the expert. But write down a list of questions so you don't forget what you wanted to ask during the appointment with the doctor. And bring a friend and bring a tape recorder and make the friend operate the tape recorder and take notes for you. And so that way you'll have a way of reviewing the information that the doctor gave you after the fact. Because the doctor's not going to be available at your beck and call all the time. But a recording and notes, you can always review them. And you can review them with other people. You can review them with, there are health libraries and resource centers. We also encourage people to collect their reports. So the reports you have, the notes, the questions you asked, the recordings, you can often find people to help you review those that are a little more available than your surgeon or your medical oncologist is.
Now, you talked a little bit about the fight or flight thing. I mean, I think people who've had cancer may know about this, but people maybe who've been fortunate enough not to. When you go in and you're listening to your doctor, you don't necessarily hear everything the doctor's saying, do you? And is that the reason for bringing the friend?
Right, exactly. Well, yeah, so often you've had a piece of bad news, and especially when you hear the word cancer, even though cancer is much more survivable than it used to be and the treatments are much better, it's still scary, it's still frightening. And so good doctors know that you shut down, and they'll often say, come back and see me after you've processed this news a little bit, and by the way, here's some sources of support. Information and other forms of support that you can go look up on your own. And then come back and we'll have a conversation about the treatment decisions that you're going to be facing. And that's when you want to bring your friend and a tape recorder and a list of questions. And again, you want to work with your doctor, so let your doctor know ahead of time that you're bringing these materials and this friend and what you'd like to do. Some doctors might be a little concerned. Why are you tape recording? Why do you want a recording of this? And I think really you tell them it's flattering for them that they're the expert and you want to hang on every word and you want to be able to listen to it later. And that you'll be happy to give them a copy of the recording. We use, here at UCSF, we use these little recorders and they're available. You can use any other type as well. And those recorders will allow you to put the recording on your computer. Yeah, the bell just rang.
I think it was
What was that chime?
Yeah, it was my phone. I'll turn it off.
Yeah.
I can do that again.
And when you do this, what you did was you held it out a bit.
Oh, okay. I need it.
Okay. You have to assume some. Again, every camera is different. How do they do the recordings? How does that work physically?
Yeah. Well, one thing we recommend is that you let your doctor know that you want to bring a friend to take notes and a recorder. And you want to let your doctor know it's because they're the expert and you want to be able to review the information afterwards. We use this kind of digital recording device, and so you can use others as well. But it's convenient to be able to record it digitally, put it on your computer, you can make a CD, you can send it to people, and offer your doctor a copy of the recording. That's really a courtesy that they will appreciate. And most doctors will understand that, someone will have questions about, why are you recording this? Is this something you're going to be, like sort of checking me off or something like that? But in actual fact, the good doctors, I think, will understand that it's because you want to be able to review what they said, the advice and information that they gave you.
What evidence do you have that this is better than the old-fashioned way of just going in, talking to your doctor?
Right. Well, so there's a lot of studies that have been done in good universities using strong research designs, publications, dozens and dozens of publications. And the overall conclusion is that reviewing educational materials before you go see your doctor does increase your knowledge and increase your capability to be involved. And in many cases, increases your outcomes, your psychological and physical health outcomes. Asking questions, making a list of questions.
We should re-ask that, because we
Yeah.
got a motorcycle and then we had the
Siren.
siren.
And this
Okay.
happens in real life,
Yeah.
too.
Well, and we're in a hospital, so the sirens
Yeah,
are...
well,
Yeah.
it is what it is.
It's
And you
credibility
just-
enhancing.
You just work around it. You just work
Exactly.
around it. I mean, this happens a lot in
Yeah.
the real world. Or if you're outside in a plane or something.
Tell me, what was the question again, so I can kind of collect my thoughts.
It was,
What
what
evidence
evidence
do you have that this
Oh, evidence,
is any,
yeah,
you
that's
know,
good.
any better than the old? I'll ask.
Yeah.
Again, that's really-
But you would normally have gotten something out of that, or not?
Yeah.
So
Oh, I've
yeah,
already
yeah,
read stuff.
yeah. So the fact that you get interrupted, you don't have to.
Right,
like,
but
sort of-
I'm not conscious necessarily. So again, what evidence do you have that this works? This newer system works any better than sort of the old-fashioned, just you and the doctor?
Yeah. So the evidence about whether all this works, asking questions, showing up with a friend, making a tape recording, and making sure that you've reviewed as much information as possible beforehand. All that has been extensively studied in dozens and dozens of well-designed research studies. And the conclusion has been, overwhelmingly, that it's not very surprising, reviewing information makes you more informed. Being more informed and being more engaged by asking questions actually leads to better psychological and physical health outcomes. And you also feel better. You have a better sense of coping with this, sometimes overwhelming condition that maybe you've been diagnosed with. So yeah, there's good evidence about the impact on educational outcomes, knowledge, and psychological and physical health outcomes.
Let's talk a little bit about how the process works. Let's say I have cancer, I come in, and you want to put me into this sort of program. I assume obviously I've gotten the word from my doctor, but what's
Yeah.
the next step then?
Yeah, well, hopefully your doctor has referred you to good sources of information and support. And if they haven't, you should ask them at any time you get this kind of bad news, what can I do? How can I be informed and involved? And for example, at our hospital, you will get referred to my program here and to the resource center, and you'll be able to review very tailored information, such as this DVD and booklet. There's a DVD inside. And so you'll be able to review high quality information. You won't just have to go out on the internet and be overwhelmed by potentially low quality information. So you want to get high quality information, and then if you're near a resource center, there's often health libraries have all the information materials, as well as staff who can help you make a list of questions and often can lend you a recording device or a tape recorder. So you want to look for that kind of resource. If it's not available, you can do it yourself. You can go on the internet and search for questions to ask my doctor, for example. Depending on your condition, you'll find ones in, let's say, breast cancer or prostate cancer. You use some keywords and then use those to brainstorm. What questions do you want to write down and take in that are applicable to you? Bring the friend. Take notes, have the friend take notes, and run the recorder. If you're in our neighborhood, at UCSF, we do a lot of this for you. We have pre-medical interns who are available to accompany you to your appointment. And you might want to ask around in your area whether, if you don't have a friend who's really qualified to take notes, sometimes friends get emotionally involved, and sometimes they just can't follow all the information. So sometimes you're able to find an advocate or a navigator. There's programs around the country that are funded by the American Cancer Society or the National Cancer Institute. So there are resources, and really my message is get informed and get involved, and it will make a difference in your care.
Now, you say you include a DVD, but why not just send them to an internet site and they can just look at your site? Why do you use a DVD?
Sure. Well, yeah. So, and those are good strategies. The American Cancer Society and the National Cancer Institute have very good websites for people facing cancer decisions, and you can get good information online. What the DVD really does is, for one thing, not everyone has access to the web, and not everyone has access in a way that they can review audio-visual materials. So a DVD really has the kinds of DVDs we use. They have interviews with other patients, and you start to see from other people who faced your condition, you start to see and hear how have they coped with it, and you see the range of possibility in cancer. You may be eligible for a number of treatments that may not be necessary, that really, where you may need to weigh how important are certain things to me. Is it worth taking chemotherapy for me in my life situation and taking on some side effects? Or do I feel like maybe hormone therapy might not give me quite as much of an advantage but might have fewer side effects? Or can I just stop with surgery, or will radiation be possible rather than surgery? So these kinds of trade-offs, your personal goals and priorities and your life situation will really make a big difference in what's the right treatment for you. So that's really the reason to use DVDs, is that you can get into a lot of this, the richness and complexity of this, with doctors and other people, other patients with the cancer or the disease. And also you can really get visual aids. You can get visual explanations, animated explanations of how cancer cells travel and how the treatment works against them.
Do you have any success stories, anything you can share about people who participate in this program that you have?
Yes, well, at UCSF we offer these services to 250 people are accompanied every year in our breast cancer clinic. And we have many stories of people who say, for example, normally I go see my doctor and I can't retain half of what they've told me. In this case, I left the appointment and reviewed the CD that you gave me in the car while I was driving home with my husband. And we both heard things that we just hadn't heard in the appointment. And it really, from the doctor's point of view, it saved us from having to call back or make another appointment and review more information, because in fact the doctor had answered our questions and we just hadn't heard it the first time. So that kind of, I would call that a success story, where we were able to really help someone be involved and be engaged and retain some of the information that they might have missed otherwise.
Would you say also that people come out of this program feeling that they really did have all of their all the possibilities in front of them and all the choices? I mean, oftentimes, cancer, as you sort of already described, there's so many different kinds of therapies. They all have their upside, their downside. It can be very difficult to kind of figure, well, which one should I do?
Well, yeah, and sometimes you ask the doctor for their recommendation, and they give you their best advice and information, but the doctor isn't you. The doctor is a completely different person. And so what we hear is that, our doctors and good doctors in general will leave the space for you, the person with the condition, to really shape the strategy. And we hear from people who've been through our support program and gotten our services that they really changed their decision dramatically compared to what they thought going in. Sometimes that fight or flight instinct led them to say, oh my goodness, I have even an early cancer, get it all out, hit it as aggressively as possible. And then they hear about the risks and also the benefits of different treatment approaches, and they might choose something more moderate than they had maybe originally thought, and still feel very comfortable that they're doing everything they can and everything they need to do, but not over-treating the condition. So that's always a balance in cancer, as in any area of medicine, is you don't want to undertreat what you have. You want to get the treatment you need, but at the same time, you don't want to get more treatment than you really want, depending on your personal goals and priorities.
And you talk, just kind of cancer, but one may be 22 years old, and
Right.
one may be 76 years old. There may be a totally different approach, right, for each of these people?
That's exactly right. Depending on your life condition, your life situation, you may feel at a young age that you want to be very aggressive and you have the kind of constitution and the ability to withstand very toxic treatments. At a much later age, you might be dealing with some other health conditions as well. You might be a little more fragile, and frankly, a very aggressive treatment that worked so well for the younger person might actually turn out to be worse than the disease. So, you need to be balancing against people's life situations and priorities.
Now you talk, I think one of the phrases you used was the patient is an agent of change. Am I correct in saying that?
Yeah.
Can you talk a little bit about that?
Well, we come from in a tradition, really, in medicine of paternalism, and that's changing very fast. And in some ways, we haven't really culturally caught up to the change. It used to be that, doctors had the book, and they were able to look things up and be involved, really drive the care that you got as a patient. Now, you as a patient, you have access through the internet and other sources to a lot of information. And, your doctors are kind of adjusting to that, and you're adjusting to it. Some of you, may be feeling like, well, my doctor's got to make the decisions. They're the expert. Well, that's true, but your doctor has to manage a huge field of expertise, whereas you are an expert on you. You know yourself. You know your goals, your priorities, your life situation, your concerns. You know how you deal with other medical situations. You know what works for you, what doesn't work for you. So you've got to bring all that to the doctor. And it's got to be a partnership, in my view, a partnership between you and an expert, where the expert is saying, let me understand where you're coming from, and then let me tell you what medicine has to offer you.
And again, to sort of wind this up, go ahead.
I need a drink, yeah, sorry.
We're coming to the close. Okay, so in terms of this patient being the agent of change, then just to sort of wrap it up and kind of come back to the point, your program helps them to be an agent of change. How?
All right, so my program here has really 3 strategies to help patients become an agent of change in their care. So the first is, get informed, get high quality information. We send it to you if you're in our program, but you can get it from resource centers and health libraries. Get good information. And then write down a list of questions and bring that list of questions to your doctor and make sure you go through them all. And bring a friend and a tape recorder and have the friend take notes and use the tape recorder to make a recording of the visit. So here at UCSF, we provide a lot of these services for you, but if you're not in our medical center or somewhere where you don't have those services, excuse me, that wasn't an intentional cough.
Yeah, exactly.
Okay, Peter.
All right, so the question was, the patient is the agent of change. Again, kind of wrapping it up, how does your program help them to do that?
Yeah, so my program really offers 3 strategies that can be used in other settings as well. So the 3 strategies are: get involved by seeking, let me start that again.
No problem.
All right, so my program, 3, 2, 1.
Do that.
My program really offers 3 strategies for people to be informed and involved, and these strategies can be used in other settings. So the first strategy is find really good information. And that information is available, and you want to ask people to recommend things from the National Cancer Institute, the American Cancer Society, really reputable sources of information. We use DVDs and materials from the Foundation for Informed Medical Decision Making, another excellent source. So once you've gotten some good materials, go through them and write down the questions that you have for your doctor. And bring those questions and bring a friend and a tape recorder. And have the friend take notes and the tape recorder record the interaction. And so, we're able to do this at UCSF with hundreds of patients every year, and we provide these services through one of our programs.